Bronchiectasis. Bronchiectasis is a condition where the bronchial tubes of your lungs are permanently damaged, widened, and thickened. These damaged air passages allow bacteria and mucus to build up and pool in your lungs. This results in frequent infections and blockages of the airways. There's no cure for bronchiectasis, but it's manageable. With treatment, you can usually live a typical life. What are the symptoms of bronchiectasis? Symptoms of bronchiectasis can take months or even years to develop. Some typical symptoms include 1. Chronic cough. 2. Coughing with blood. 3. Atypical sounds or wheezing in your chest with breathing. 4. Chest pain. 5. Shortness of breath. 6. Coughing up large amounts of thick mucus every day. 7. Weight loss. 8. Fatigue. 9. Change in the structure of your fingernails and toenails, known as clubbing. 10. Frequent respiratory infections. If you are experiencing any of these symptoms, you should contact a doctor immediately for diagnosis and treatment. What are the treatment options for bronchiectasis? There's no cure for bronchiectasis in general, but treatment is important to help you manage the condition. The main goal of treatment is to keep infections and bronchial secretions manageable. The most common treatment options for bronchiectasis include 1. Chest physiotherapy. 1 form of chest physiotherapy is a high-frequency chest wall oscillation vest to help clear your lungs of mucus. 1. The vest gently compresses and releases your chest, creating the same effect as a cough. 1. This dislodges mucus from the walls of the bronchial tubes. 2. Surgery. 2. If there's bleeding in your lung, or if the bronchiectasis is only in one part of your lung, you may need surgery to remove the affected area. 3. Draining secretions. 3. Another part of daily treatment involves draining the bronchial secretions, aided by gravity. 3. A respiratory therapist can teach you techniques to aid in coughing up the excess mucus. 4. Treating underlying conditions. 4. If conditions like immune disorders or COPD are causing your bronchiectasis, your doctor will also treat those conditions. 5. Lifestyle changes. 5. Things like exercise, eating a healthy diet, and drinking plenty of water may help improve the symptoms of bronchiectasis.